Hi there, I'm Dr. Andrea Shanowski from Freedom Chiropractic and Holistic Health in the Peoria Metro Center, and I wanted to share with you today a little bit more about what you need to know after an auto accident. So in many cases, when we look at the number of auto accidents that happen, there's about 5 million accidents that happen every year in the United States. And about 40% of people are injured during the car accident, but they don't necessarily know what they should be doing when the accident happens or what they should be doing to seek out medical care. So I wanted to go over a couple different tips for you today. The first thing is when you get in a car accident, you want to check for injuries. Now, keep in mind, sometimes we can have some immediate traumatic injuries that happen during the accident that need immediate medical attention and medical care, and you may be rushed to the ER or get an ambulance at the scene of the accident to get you taken care of and checked over. However, a lot of times we can also have soft tissue injuries that happen a couple hours or even the next day or even a couple days later, where you may be noticing that you are stiff all over, you may have muscle spasms or some pain, not just in your neck and shoulders. I've also had patients that were injured in their jaw, injured in their elbow, their wrist, their knee, their ankle. I've even had some patients that have back pain because of the way the accident happened. Their body was twisted or they were hit at an angle and it caused their body to twist during the accident and cause pain in their lower back or in their lower leg area. Or if they hit the door or they hit their knee on the dashboard, that can also cause some issues for them too. So you want to make sure you understand, number one, immediate medical injuries need to be taken care of at the scene of the accident, either with the ambulance or potentially the ambulance may need or see the need that you need to get transferred to the ER for some further evaluation or x-rays or CT or anything like that. The second thing you have to do if you are not incapacitated and have to be rushed away from the accident, it's very important to make sure that you're calling the police to make an accident report. We want to make sure the police actually respond to the scene so that they actually take some pictures, or they may just write in the report exactly what happened, who is at fault, and make sure that everybody is safe and document everything. What you need to do after the police or before the police arrive as you're waiting for them to get there is you want to make sure you're collecting evidence. That means taking picture of your car, taking picture of the other car or other vehicle that was involved in the accident. You also want to make sure that you're taking pictures of the intersection or place where the accident happened. If there's any signs, if the roads were really icy or something like that, you want to make sure you're collecting evidence. If there's any witnesses, you want to make sure you're getting not just their name and phone number, but the city and state that they live in. That way, if perhaps you wrote the phone number down wrong or it got wet and you don't have that information, you know the city or state where they're located, so that your lawyer or the police officers can ask them for their witness statement. And then you want to make sure afterwards that you've collected the evidence, you've collected witness information, and then you want to make sure you contact insurance companies. Now, there's many different ways that you can go about this. A lot of times you can actually go through your insurance company, so you can contact them, open a claim. You may have something called MedPay available, where basically your insurance company will have a set amount of money set aside. So if you need to seek out medical care, whether that's from the ER, whether that is going to a chiropractor or PromptCare, whatever it may be, you may have money available for MedPay to cover those bills immediately after the accident happened. If you decide to file a claim with the other person's insurance, they may open what's called a third-party bodily injury claim. So you have one claim for your car, one claim for medical injuries that were sustained. Usually that third-party bodily injury claim, once you're done with treatment and you're released back to normal care, whether you've gotten a full recovery or not, we want to make sure that's documented in your medical notes. But after your care is received, you're going to take those bills and basically ask for them to reimburse you or pay the provider if they have a medical lien on file to cover the costs associated with that medical care. If you're having trouble communicating with your insurance or the other person's insurance, you may want to consider talking to a lawyer as well if you feel like that would be in your best interest. Keep in mind, typically when you retain a lawyer, there are going to be liens on file. A lot of times there are delays with processing just because of communication. Lawyers are going to make sure that they are getting not only the witness statements and the police reports, they're going to be talking to the other insurance company. A lot of times they're going to be filing suit, seeing to see if they come back for a settlement. And sometimes it can be pretty messy. I know a lot of times insurance companies we'll try to do a settlement so you don't have to go to court. However, a lot of times when they're settling very early or offering you money very early, that may not necessarily be enough to cover the bills to fix your car, as well as cover any medical claims that you may have, or if you may need to seek out treatment. So a couple things to keep in mind. Like I said, number one, check for injuries. Keep in mind, if you do have injuries hours, days, or even a couple days or a week later, you can still get those checked out. You may have med pay available through your insurance, or if you're going through the other insurance, you may have to pay those bills, or you might be able to talk to the doctor about doing a medical lien. That way, when you're done with care, they can then basically, that insurance company can pay that doctor directly. So those are a couple tips. Make sure, like I said, no matter what, you know exactly what your rights are in the state of Illinois. Have a great day.